Happy Day M.O.P. Warm greetings from the Student Ministry of Health and Hygiene M.O.P. SANSAD 2025-26. Welcome back to part 2 of the session under the InSync campaign on menstrual and mental health. During our last session, we gained valuable information from our guest Dr. Jaishree Gajaraj, Senior Consultant in Obstetrics and Gynecology. In this segment, we will continue our conversation with a focus on deeper insights and practical perspectives guided by our distinguished expert. Let us now move forward with the next set of the questions, once again reflecting the thoughts and concerns of the student community. Can menstrual hygiene products cause infections or health issues, ma'am?
So when you're talking of menstrual hygiene products, I'm assuming that it's the washes and the solutions that are
Yes, ma'am.
okay. There is no need to use any of these solutions. Most women maintain good menstrual hygiene. Now they get worried when they have a period, etc. But using the right type of pad, and nowadays I think tampons were popular at one time, but then slowly they have fallen, out of uh, preference. The menstrual cups are nowadays being spoken about for menstrual fluid. Now, off the lot, either a good pad. Now, the pads itself, as you know, there's been a lot of improvement in the quality of the pads. And now you have the washable pads, you have disposable pads which are made from recycled material. Menstrual cups seem to be gaining a lot of popularity nowadays. And even in the menstrual cups, you have single use and you have reuse type of menstrual cups. On the whole, I would suggest that if the girl is comfortable with using menstrual cups, that's probably the best thing that she can use, because the fluid gets collected. She can actually never have an overflow. She can change as she needs, and then she can reuse it again. It's something she can carry easily with her. So I would probably recommend menstrual cups. But there is this little taboo in our culture whether a girl should be using this intravaginally or not before she gets married. I think we need to move along with times. And these things should not matter, is my own very personal opinion. I don't know.
So, lifestyle plays a huge role in women's health today. How do factors like diet, stress, or lack of exercise actually impact the menstrual cycle and fertility, ma'am?
We go back again to the same weight gain and the obesity issue in this, because stress, excessive eating, lack of exercise, all this again boils down to weight gain. Weight gain, hormonal imbalance, irregularity in menstrual cycle. So this kind of is a vicious cycle which can be broken by only one thing, and that is weight loss. And in all this, sometimes stress can be added on. Stress, external stress, and then the stress of I put on weight, I cannot lose weight, right? So this all put together, I think, definitely will affect the menstrual cycles. We need to take care of it. If somebody needs help, they need to go and see a doctor and take that help.
Yes, ma'am, definitely.
See, often people say, I have thyroid, therefore I'm putting on weight.
Okay,
Now,
yes,
that's
ma'am.
a wrong concept.
Yes, ma'am.
Okay, if you have thyroid, hopefully you've done your test, you're taking your tablets, and then you have replaced adequately. So, when that happens, that can never be an ongoing reason for putting on weight. So, like that, there are many things which a doctor can point out to you. So, go and meet your doctor and take help from there.
Ma'am, just like that, can you please explain about why it is important to get the right advice on how to do weight loss? Because often people follow social media and influencers without consulting an expert.
Very true, because I think nowadays we are bombarded with information on the media. Now, the correct way of doing it is eating less, eating the right food, and burning up what we eat. So, we all eat primarily not for hunger but for taste. Okay, so when we eating for taste, we are eating the wrong food. Now, many people, when we come to see us, they'll say, I eat very little, doctor. This is all that I eat, but I'm putting on weight. That can never be true. Okay. So I have changed my strategy and say, even if you're eating so little, cut that by 50%. Right? Now, when you actually go into the details, you will find their idea of reduced food is not reducing carbohydrates, it's not reducing fat, not reducing calories. They will still eat, say, like 4 idlis a day, and they'll tell you they're not eating rice. So, my next question is, how do you make idlis at home? isn't it from rice? Right? So their concept is rice as in cooked rice. So they feel they can eat idlis, they can eat dosa, they can eat anything else, but they won't eat rice. So there are a lot of wrong concepts. If you sit down and talk to people, my general advice is sit down, write what you have eaten for the last 3 days, every detail. Then circle off what all you have eaten, which you need not have eaten. There will easily be 5 or 6 items. So to begin with, cut that. The next step, identify what is excess carbohydrate, excess fat, excess calorie. Next round, cut that. By that time, you would have started your weight loss. And that itself is an incentive for more weight loss. Then you go back, you revisit your list and see where you can cut, but where you want to add on something. Because there is a center in our brain called satiety center. So that has to be satisfied. So when you have to be satisfied, your tummy has to be full. If not, you will start picking on all high calorie food that is around the dining table. So fill yourself with a lot of salads, a lot of fiber, and water. So all this will fill your tummy. Once this happens, you will not eat food that you should not be eating. Then the next part of the whole thing is exercise. Now, exercise is something we should be comfortable doing. Otherwise, we will never do it regularly. And the most comfortable exercise that we all do is walking, and something we're used to. So let's start walking at least half an hour a day. If during the week you're too busy, try to increase it to 1 hour on Saturday, 1 hour on Sunday, or whatever amount that you're able to do. So that kind of keeps your muscles strong, your bones strong. It's a kind of weight bearing exercise, and you also burn up a lot of calories. So that's, you don't have to go to a gym and start paying a lot of money and trying to lose 10 kg. My usual recommendation is aim for 2 kg a month, but do it as a steady loss. So 2 kg every month, you're talking of almost 24 kg in a year in people who need that much weight loss. Otherwise there is really no need to. It's a rough calculation that I'm telling you. So diet and exercise, a good balanced combination is more than enough for a good healthy lifestyle.
Those were wonderful suggestions, ma'am. But as we speak about social media now, teenagers today, they consume a lot of information from the media and AI especially. What is your opinion on that, ma'am?
A very good and pertinent question, I think, because it all started with, mails and then text messages, WhatsApp, and now even as you're thinking of something, AI suddenly throws up suggestions for you on whatever you want to do. So, do you want to go out for dinner tonight? It immediately is telling you what to do. So AI is actually a very good tool. It gives us a lot of information. It gives us very useful information. So we are the people who should know how to discern what is good and what is not for us. So generally, take what is good. Now, what is bad is something we may not know what is bad for us. So if we are looking for information, it should be specific information, not just at random browsing and then trying to get information and trying to use it for what we need. Rather than looking for what we need is the way we should use AI. And about menstrual hygiene, I think even WhatsApp and social media has a lot. AI is now giving suggestions on what products to use, what pads to use. So we need to be careful. That's my only message is let's be careful. Use it. It's not wrong, but use it sensibly.
Thank you for the advice, ma'am. Why do some individuals report intense mood swings or even depressive episodes linked to their cycles, while others experience minimal or no mental health changes, ma'am?
It's again a question of attitude and interplay of hormones. So, if you are somebody who is basically an extrovert, who has a lot to engage in, then the monthly menstrual cycles become secondary. It comes, it goes, it's part of your life. Now, if on the other hand, you're somebody who is more of an introvert, reflects more on your own self, your body, basically someone who indulges in self-pity and things, then even this 3 days of periods and menstrual cycles start becoming a burden. So then, that's the reason why you have all these mood changes, etc. It is to some extent due to the hormones itself, but a lot has to do with what we perceive it as. So it's something that can be manageable, and I don't think any girl should ever think of it as a burden. It's part of our life.
I think that answers many of our questions as well. What are some benefits of tracking menstrual cycles, and how can women use this vital information to improve their health?
See, there was a time when, many years ago when we all used to practice, one of the questions we would ask is, when was the last period? And then obviously they don't remember. They look around, either the mother or the husband or somebody else will come up with a date related to some event in their life. So that's how it was going on. And it used to be a bit kind of irksome for us because, we need that information. When was the last period? So the apps nowadays are very welcome by the gynecologists because the minute we ask them, they pull out their phone and they're able to tell us the whole menstrual cycle. Why are we happy about it? Because to treat any condition, is she having heavy periods? Why has her hemoglobin dropped? One look at her menstrual chart for the last 6 months will give us a lot of information. So, how many days did the period last? Was her bleeding heavy? Was she bleeding frequently? Was it every once in 21 days? So, all this information is very, very vital. It helps the doctor to treat her better. So I encourage that people maintain this menstrual chart, maintain a digital record of the menstrual chart because it's easier to interpret. So I think it's extremely good thing.
Yes, ma'am. How can one reduce the risk of gynecological cancers? And could you please tell us about the methods to improve pelvic health, ma'am?
So the gynecological cancers that women often come across are cancer of the mouth of the uterus called cervix. That's cervical cancer. The body of the uterus called the endometrial or the uterine cancer. And then we have two ovaries on either side. So ovarian cancer. These are the three commonest. There are number of other cancers as well. Now, to some extent, breast cancer is also included in this because it's one of the common cancers in women. So, can we prevent it? Yes, to some extent. The cancer that can definitely be prevented is cervical cancer or cancer of the mouth of the uterus. Now, it is associated with a viral infection called human papilloma virus. Now, this virus, fortunately, we have got a vaccine against this virus called the HPV vaccine. And we are now recommending this, the government has also recommended this for girls who are between 10 and 15 years of age. We are giving this vaccine on a regular basis. Even for older girls and older women also we are giving these vaccines. So cervical cancer can be prevented 99.9% by giving this vaccine. Other cancers, it is more a question of early detection rather than prevention. Early detection means you go regularly for your pap smears or cervical smears. You go regularly for annual or ultrasound examinations. If there is a family history of either breast cancer, ovarian cancer, then there are some blood tests and ultrasound that we can do to find out if that particular woman is at risk. So again, we take the help of a doctor. Regular checkups are very important, but the most important thing that has happened in the last maybe 15 years is the HPV vaccine.
Ma'am, you have mentioned about visiting the gynecologist, but many women hesitate to actually visit a gynecologist unless they have a major problem. Could you please explain why regular gynecological checkups are important and at what age should women ideally start going for the checkups?
See, most women, when they come to us with a problem in their 40s or late 40s, their first opening sentence is, I have not seen a gynecologist after my last childbirth, which was 25 years ago. And then I feel very sad when I hear that because there's no need to go and see a gynecologist only when you have a problem. There are regular checkups that one can go for. From the age of 40 onwards, we actually advise an annual checkup. An annual checkup doesn't necessarily mean all the tests need to be done. When you go to a gynecologist, they will examine your breast. They will probably take a pap smear once in 3 years. An ultrasound can be done once a year. And some routine blood tests can also be done. And if there is any problem, they will probably refer you to the specialist who needs to take care of you. So an annual visit from the age of 40 is extremely important. Gynecological visit is important because some women have, say, heavy bleeding and they just think it's normal. They don't bother to take help. And when you go to the gynecologist, they may do a blood test and find that, she's anemic. Her hemoglobin may be 8. And she may be wondering why I'm feeling tired, but then I'm able to manage. So when you have some symptoms, the interpretation of that symptoms may be better done by a doctor, maybe a gynecologist, rather than just sitting at home and putting up with the symptoms. So I would definitely say after the age of 40, one visit to whoever you're comfortable with. It can be your family physician, it can be a general physician. Most women are comfortable with their gynecologists. So I think it's good to see them as well.
Finally, every woman deserves awareness and access to gynecological care without stigma. In your view, what steps can families and communities take to create a more open and supportive environment for women's health, ma'am?
I think it's again a very, very relevant question because the woman in the house, okay, be it a homemaker or a working woman, whoever it is, we all know that she multitasks. She does a whole lot of things, but what she does not do is take care of herself. She is whirling around the whole day, morning to night, and then takes a little rest, again gets back in the morning. So, in all this, she doesn't think about herself. Even if she does, it's like takes back seat. So, where we all can help is the family. If there is a daughter, if there's a son in the family, an occasional, have you seen the doctor? Have you done your blood test? Or the husband in the family can ask, when did you last go for a health checkup? So these little things, the supportive care by the people around her. It can be a friend also, it can be a colleague. Anybody can give her that little advice and push her because very often they want to go, but it doesn't take priority in their mind. So I feel people around, even all of us, should just tell each other, why don't you go and see a doctor? Tomorrow I'm going to see my doctor, why don't you come along with me? So these little things, you can take people along with you. That will definitely improve women's health all around.
We have spoken so much about menstrual health and hygiene, ma'am. So, in that context, could you please tell us about contraception and sexual health, ma'am?
Yeah, thank you. Thank you for asking that question because I think we need to have that knowledge as well. Now, any girl, she has her own plans. She wants to plan a family whenever she's ready for it, etc. So she needs to know what she can do to postpone an unwanted pregnancy and when she is ready, how to plan for that pregnancy. So postponing an unwanted pregnancy or, the first pregnancy itself means using a contraceptive method. When we talk of contraception, there are many methods to prevent a pregnancy at the same time carry on a very healthy sexual life. So the methods that are available are the pill. You have intrauterine devices that can be put in. You have barrier contraception called condoms or sheets. So there is a variety of what is available. And ideally, rather than choose oneself, I would probably advise that they go and meet a doctor, discuss, because some of the products should not be used by girls who have certain medical conditions. So it may be good to start using it in conversation with the doctor. Having said that, the other thing is planning a family itself. Now, when they are planning a family, there are again something called a preconception counseling. So they need to go and see their doctor. Some medical conditions can be ruled out by doing tests. They need to start taking folic acid supplementation. They need to probably reduce weight. Do they have sugar which can be controlled? So again, planning a family and postponing a family are two aspects that a girl has to be familiar with. And it's, I think, entirely up to us to educate them about it.
On that note, I would like to give a big salute to all the women in our lives.
Certainly, there's no doubt.
Yes,
Women have to be saluted.
yes, ma'am. Thank you, Doctor. It was an absolute honor to have you with us for the interview. Your insights on women's health and your inspiring journey in the field of gynecology and obstetrics were truly enlightening. I'm sure the student community will be benefited from the information gained. We are grateful for the time you took to share your expertise and experiences with our audience. Thank you once again for joining us and making this session impactful. That concludes part 2 of our session with Dr. Jaishree. This session was brought to you by the Student Ministry of Health and Hygiene, M.O.P. SANSAD 2025-26. In our next session, we will meet you with yet another expert to shed light on the various aspects of menstrual and mental health. Thank you.